Hi, I'm Josette McConville, infection preventionist with Nebraska ICAP. This is a brief training on providing education and promoting antibiotic stewardship efforts to both nursing home residents and their family members. As with other presentations in this fundamentals course, we will take a look at CDC's core element associated with this topic. It states, nursing homes engage residents and their family members in antibiotic use and stewardship educational efforts to ensure clinicians have their support to make appropriate antibiotic use decisions. Working with residents and families will reduce the perception that their expectations may be a barrier to improving antibiotic use in nursing homes. Before we move to the next slide, take a second to reflect. Does your organization provide education to residents and family members on appropriate antibiotic use? If so, how is this currently done? And is there an opportunity to do more? Effective communication with residents and their families helps to address treatment expectations. It helps to reduce the expectation of an automatic antibiotic prescription. Additionally, there's an opportunity to talk to residents and their families about when antibiotics are and are not needed, and to discuss possible harms such as allergic reactions, C. difficile, and antibiotic-resistant infections. Healthcare professionals in the nursing home can help reduce inappropriate antibiotic use by utilizing a four-part communication strategy promoted by CDC that we will look at further on a later slide. A good strategy in promoting stewardship is to be proactive. Don't wait until an antibiotic is ordered to start the discussion. Be deliberate and consistent in your messaging. Proactive education gives you the opportunity to set the stage to say, this is how we handle communication about potential infections and our facility's commitment to preventing overutilization of antibiotics. Standardized communication strategies allow for all staff to share the same message. It is important to consider various methods of information sharing that are preferable to residents and family requests and learning styles. Consider working with your resident councils to determine preferential methods of information sharing. Options of communication could include on-demand videos on the facility's website, posters, handouts, sharing information in a monthly newsletter, and individual one-on-one discussions or email notifications as needed. CDC recommends focusing discussion toward individual-oriented conversation focused on potential harm to the individual. When discussing antibiotic resistance, it can be more impactful to emphasize how it affects the resident personally or those that are closest to them. Framing the issue this way helps to make the threat more relatable and underscores the importance of appropriate antibiotic use. Public education campaigns have frequently focused on the spread of antibiotic resistance. Some research indicates that this approach may not be the most effective messaging to convince an individual why they should not request a non-indicated antibiotic. Focusing education on the overall large societal harm may not have the most impact. In considering how to best dissuade a patient from non-indicated antibiotics, clinicians should keep in mind that different types of statements may have more of an impact on members of some demographic groups than others. For example, statements about the impact of pregnant women taking antibiotics on the development of babies may have a greater impact on women than using that same example when educating a man. Level of educational attainment also can impact educational needs. Those with a lower level of education were more likely to both initially desire antibiotics and be dissuaded by the statements than other groups. Providing education about potential harm, individual harm, may be the most effective for those with lower levels of education. Discussion about individual risks includes talking about risks of personal allergy, side effects of the medication, potential for drug-drug interactions, and the risk of C. diff. Always keep the discussion simple, understandable, and directly related to the patient. Effective communication is a cornerstone of improved patient-centered outcomes. When using posters or handouts, there are a number of techniques to keep in mind to be most influential. Keep it simple. Keep the design simple and clear, use a limited color palette, and avoid cluttered layouts. The message should be easy to understand at a quick glance. Maintain consistency in the design element, such as fonts, colors, and imagery. This helps create a cohesive and professional look for the posters. Use relevant and visually appealing images or illustrations to grab attention. Images of germs, hand washing, PPE can help reinforce the message and make the poster more engaging. Use legible fonts and ensure that the text is large enough to be easily readable from a distance. Avoid using long paragraphs and instead consider bullet points or short sentences to convey information. Include a clear call to action that encourages the reader to take specific steps for infection prevention or antibiotic stewardship activities. Emphasize the most important information, by using language that can be easily understood by everyone, including those with limited literacy or language proficiency. Display the posters in prominent locations where they will be easily seen by both staff and visitors. Consider placing them near hand washing stations, entrances, or in common areas. Antibiotic stewardship should not be a burden. However, it requires a sustained and coordinated effort. It is important to increase availability and dissemination of education related to antibiotic use. Coordinated communication allows for communicating the facility's commitment to appropriate antibiotic use. This slide shows a templated letter that could be used to share this commitment. Ask the resident and family to make a commitment toward safe antibiotic use, such as not pushing for an antibiotic when a doctor says that it is not needed. There are many sample education handouts and posters online that can be used as is, or use them as a template and customize them to your facility's needs. These samples shown here are from the CDC. Here is a sample document from the Agency for Healthcare Research and Quality, AHRQ. It is specific toward urinary symptoms and antibiotic use. This would be an example of education that could be used proactively or could be used in the moment when a resident is having urinary symptoms that are not indicative of an antibiotic or infection. Here are a few additional education examples. The link should be active when accessing the slide deck. Consider where and how you will engage staff to provide the standardized resident and family education. You could make it a topic at the annual competency fair, at a routine staff meeting, or daily huddle. Consider how often you're going to have recurring education and reminders. The goal should be to make this a culture change and expectation for communicating with residents, and not have antibiotic stewardship just be happenstance or informal conversations. Leadership support is necessary to make this cultural shift. Topics to use when prepping staff to have these conversations with residents and families include asking staff to discuss what questions and challenging scenarios they encounter from residents or family members. Encourage staff to demonstrate active listening and provide talking points. What are symptoms of urinary, respiratory, and soft tissue infections? What symptoms could indicate a different concern, such as when this may be a virus or dehydration and not an infection? And talk about with staff risks associated with overuse of antibiotics overall. CDC recommends utilizing a 4-part communication strategy with patients. Communication skills training has been shown to significantly reduce inappropriate antibiotic prescribing. The slide link provides clear scripts for communicating about asymptomatic bacteriuria and respiratory illness scenarios. These scripts can be utilized for staff to role-play conversations with residents. And finally, I want to leave you with a suggestion. If you don't already have a robust program to offer resident and family education related toward stewardship, U.S. Antibiotic Awareness Week raises our consciousness and provides a good opportunity to kick off an education campaign every November 18th through the 24th. Each year, a toolkit is updated with activities, posters, and other tools such as social media buttons. Consider using this week to promote stewardship with staff, residents, and families in your facility.